There is a type of dementia that does not always begin with dramatic memory loss. And that is exactly why so many adults over 60 miss it until the damage is already spreading. People assume dementia always starts with forgetting names, losing keys, or repeating the same question. But vascular dementia can begin very differently. It can start with slower thinking, a subtle change in walking, a personality shift, or a moment of confusion that gets brushed off as stress, aging, or just having a bad day. And when families miss these early clues, they often miss the window to act while action still matters. I'm Dr. Michael Joel, and I need to tell you something that may protect your future or someone you love. Vascular dementia is not just about memory, it's about blood flow to the brain. And when that blood flow is reduced, brain cells don't receive the oxygen and nutrients they need to function normally. Sometimes the change happens after a recognized stroke. Sometimes it happens after a series of tiny, silent injuries no one even notices. That is what makes this condition so dangerous. It can creep in quietly, and by the time the signs are obvious, a family may look back and realize the clues were there all along. In this video, I'm going to walk you through 8 early signs of vascular dementia that many people miss, and I need you to stay with me all the way to number 3. Because number 3 is the one families dismiss the most. They call it stubbornness. They call it tiredness. They call it old age. They call it everything except what it really may be. And by the end of this video, you'll understand not only what these 8 signs are, but also why vascular dementia often looks different from what most people expect dementia to look like. Before we begin, please subscribe to this channel, share it with someone you love, and stay with me for guidance. This matters more than you think. Let me start with George from Columbus, Ohio, because his story reveals how easy this is to miss. George was 72, retired from the Postal Service, proud, independent, sharp with numbers his whole life. His daughter first noticed something small. He wasn't forgetting her birthday. He wasn't forgetting his grandchildren's names. Instead, he would stop in the middle of simple tasks and look unsettled, like a man who knew exactly where he was but suddenly didn't know what step came next. He laughed it off. Said he was tired. Said everybody slows down. But what was happening to George was not normal slowing. It was an early warning. And before I give you sign number 8, you need to understand one thing that changes everything. Vascular dementia often affects the brain's wiring, the connections that help you plan, organize, judge, focus, and move smoothly from one thought to the next. That means the first change may not be forgetting who your daughter is. It may be taking much longer to make a decision, struggling to follow familiar steps, or becoming, noticeably different in mood and behavior. That's why families miss it. They're looking for memory loss while the real clues are showing up somewhere else. Sign number 8 is a change in mood or personality that seems too mild to worry about. This is one of the earliest clues, and it is missed constantly. A man who is warm and patient becomes irritable. A woman who always loved church, card games, and Sunday dinners suddenly seems detached, flat, or uninterested. Someone who used to laugh easily becomes unusually suspicious, frustrated, or quick to anger. The family thinks maybe it's loneliness. Maybe it's retirement. Maybe it's grief. And sometimes it is. But when a real personality shift appears along with changes in thinking, you have to take it seriously. Let me tell you about Nancy from Tampa, Florida. Nancy was 69, energetic, organized, and deeply involved in her family. Then over several months, her son noticed she had become strangely withdrawn. She stopped answering calls. She lost interest in gardening. Small inconveniences made her furious. She wasn't sad in the way people usually describe sadness. It was more like her spark had dimmed. Everyone assumed she was simply adjusting to getting older and spending more time alone. But the mood change was not the whole story. It was one piece of a larger pattern that eventually pointed to vascular injury, affecting how her brain regulated emotion and motivation. Here's why this matters. When blood vessels in the brain are damaged, the regions involved in emotion, drive, judgment, and behavior may be affected long before a family says, "I think this is dementia." So if you notice depression, apathy, agitation, or personality changes that don't fit the person's usual character, Do not brush them aside too quickly, especially if those changes show up with confusion, slowed thinking, or trouble handling everyday life. Mood is not separate from brain health. Sometimes mood is the first flashing warning light that something deeper is changing inside the brain. Sign number 7 is trouble doing tasks that used to be easy. And I want you to hear this carefully because this is not about forgetting one recipe or making one mistake with a bill. This is about a repeated new difficulty with step-by-step tasks that were once automatic. A person starts a familiar process and can't complete it. They know what the task is, but the sequence keeps slipping away. They may stare at the microwave, open the checkbook and freeze, or put laundry in the washer and forget what to do next. That's not just being distracted. That can be a serious clue. Let me tell you about Patricia from Des Moines, Iowa. Patricia had handled the household bills for 40 years. She knew every due date, every account number, every routine. Then her husband noticed late notices piling up on the kitchen counter. Patricia wasn't forgetting that the bills existed. She was getting overwhelmed halfway through paying them. She would sit down, start, and then become confused about what order to do things in. She began making simple mistakes while cooking too, skipping steps she had followed her whole adult life. She wasn't careless. Her brain was losing efficiency in a very specific way. That kind of breakdown matters because vascular dementia often interferes with executive function. That's the brain's ability to organize, plan, shift attention, and carry out a sequence. And when executive function starts to weaken, daily life becomes strangely hard in ways that don't look dramatic at first. A person may still sound normal in conversation. They may still remember family stories from 20 years ago, but ask them to manage a new insurance form, follow instructions, or prepare a meal with several steps, and suddenly, the cracks begin to show. Those cracks are often the beginning of a much bigger problem. Sign number 6 is getting lost or disoriented in places that should feel familiar. Now, I'm not talking about taking a wrong turn once in heavy traffic. I'm talking about a person becoming confused on a route they have driven for years, or misplacing things in bizarre ways and not understanding how they got there. This sign frightens families because it feels so out of character. Someone who once had a strong sense of direction suddenly cannot confidently navigate the neighborhood grocery store, the road to church, or the hallway sequence inside a clinic they've visited many times. Carl from Phoenix, Arizona, was 74 and still driving to the same diner every Saturday morning. One afternoon, his daughter got a call from him. He was only 10 minutes from home, but he sounded shaken. He knew the area. He recognized the gas station on the corner. Yet he could not figure out which direction to turn to get back to his own subdivision. He made it home safely, but then similar moments began happening inside stores and even inside his own routine. He started putting his wallet in the freezer, his reading glasses in the pantry, and insisting someone else had moved them. This is one of those signs families want to minimize because it is scary. But getting lost on familiar routes or repeatedly misplacing items in illogical places can reflect more than simple forgetfulness. It can signal a change in attention, visual spatial awareness, and the brain's ability to map familiar environments. And in vascular dementia, those abilities may falter early depending on where blood flow has been disrupted. If a loved one begins getting disoriented in once familiar settings, don't just blame aging. Aging does not normally erase a well-worn map of everyday life. Sign number 5 is trouble with words, reading, or writing. This one is subtle because families often think the person is just tired, embarrassed, or not paying attention. But if someone starts struggling to find simple words using the wrong word, losing track while reading, or having new trouble writing a check or text message, pay attention. Language changes can be an early clue, especially when they arrive with other thinking problems. The person may know what they want to say, but it won't come out correctly. Or they may read a paragraph 3 times and still not absorb it. Eileen from Pittsburgh, Pennsylvania, loved her book club. She had been the woman everyone turned to for sharp observations and lively conversation. Then one evening, during a discussion, she kept stopping mid-sentence. She reached for common words and couldn't land on them. When she tried to joke about it, the group laughed kindly, but her daughter noticed something deeper. At home, Eileen had started mixing up written instructions, skipping words in emails, and abandoning books she once would have finished in a weekend. It wasn't just forgetting. It was a change in how her brain was processing language itself. Why does this happen? Because vascular damage can affect the networks that help language flow smoothly. The result may not be complete speech loss. It may be something much more deceptive. Hesitations, wrong words, trouble following written instructions, or difficulty learning new information. And because these moments come and go, families often tell themselves it's stress, it's not enough sleep, it's normal. But when language changes become part of a pattern, especially in someone with high blood pressure, diabetes, stroke history, or heart disease, that pattern deserves a medical evaluation. Sign number 4 is a physical sign many people never connect to dementia at all. It's a change in walking, balance, or body control. The person becomes slower getting up from a chair. Their steps get shorter. Their stride becomes hesitant, almost shuffling. They may seem less steady in hallways or need to grab furniture as they move through the house. Sometimes there's also new urinary urgency or difficulty controlling the bladder, and families assume those issues have nothing to do with the brain. But in vascular dementia, they absolutely can be connected. Let me tell you about Harold from Nashville, Tennessee. Harold's wife didn't first notice a memory problem. She noticed that he had started walking differently. He used to move quickly through the kitchen. Now he took cautious, tiny steps and turned more slowly, as if his body needed extra time to understand the command. Then came the near falls. Then the rushed trips to the bathroom. Harold insisted it was just his knees. But the knee x-rays didn't explain the full picture. When the thinking changes and gait changes were looked at together, the real concern became much clearer. This is such an important clue because vascular damage can affect areas of the brain involved in movement, coordination, and control. That means the first visible sign may actually be in the legs, not the memory. A person may appear physically older almost overnight. Family members say, "He just slowed down," or "She's become careful." But if walking becomes unsteady, balance worsens, or bladder control changes alongside confusion or planning problems, that combination matters. The body and the brain are telling the same story. You just have to realize they're connected. Now we come to sign number 3, the one most people miss. And I need you to listen closely because this is the sign families explain away for the longest. Sign number 3 is slowed thinking, not simple forgetfulness. Not just taking a little longer because someone is in their 70s. I'm talking about a real slowing of mental speed. The person can still answer, but there is a longer pause. They can still make a decision, but they seem stuck before starting. They can still understand a conversation, but only if it moves slowly and doesn't require rapid back and forth thinking. Let me tell you about Lorraine from Cleveland, Ohio. Lorraine was 71, a retired school secretary, quick-minded, practical, always the first to solve a problem. Her daughter noticed that conversations had changed. Lorraine wasn't saying obviously strange things. She was just slower to respond. If you asked her 2 questions in a row, she seemed overloaded. If plans changed suddenly, she froze. If a form had several parts, she stared at it longer than she used to. The family thought maybe she was tired. Maybe hearing loss was making her seem slower. But what they were seeing was one of the classic early features of vascular cognitive decline. This sign is missed because slowed thinking does not look dramatic. It looks like age. It looks like a person being more deliberate. It looks like someone who just needs another minute. And in fairness, healthy aging can involve some slowing, but vascular dementia goes beyond that. The person begins to struggle with mental speed, flexibility, planning, and problem solving in a way that affects real life. They hesitate more. They need repeated prompting. They become uncertain about what to do next. And that uncertainty can show up before major memory loss ever becomes obvious. Here's the question I want you to ask yourself. Is this person simply taking their time, or has the whole engine of thinking begun to slow down? Because when blood vessel disease affects the brain, signals do not move efficiently. The result is not always dramatic confusion. Sometimes it's just that everything takes longer. Answering, planning, judging, adapting, following through. If number 3 is happening, do not dismiss it as stubbornness, laziness, or dad just being dad. That attitude delays diagnosis more than almost anything else I see. Sign number 2 is a decline that happens in steps instead of one smooth, gradual slide. This is a huge clue. A family says he was doing okay, then after that hospital stay, he just wasn't the same. Or she seemed fine until that mini stroke, and then there was a clear drop. Vascular dementia often has this stair-step pattern because each stroke, mini stroke, or blood vessel injury can take away a little more function. The person may plateau for a while, then worsen again after another event. That pattern is very different from what many families expect. Robert from Buffalo, New York, is a perfect example. At 70, he managed fine after a minor stroke. A year later, after what doctors believed was a transient ischemic attack, his wife noticed a meaningful drop. He could still dress himself and carry on a conversation, but he had more trouble following directions and organizing tasks. Then months passed with little change. After another health scare, there was another drop. Each time, the family adjusted and normalized the new baseline. They kept saying, well, that's just where he is now. But those step-downs were a critical diagnostic clue. And I need to tell you something important here. If someone has sudden confusion, new speech trouble, face drooping, weakness, severe imbalance, or abrupt vision changes, that is not a wait-and-see moment. That is 911. Because a stroke or mini-stroke may be happening, and time matters. But even when the emergency passes, families sometimes fail to connect the afterward changes to the bigger vascular picture. If thinking, planning, or function worsens after a stroke, TIA, heart event, or major vascular problem, that is not something to casually shrug off. It needs follow-up. And now sign number 1, the sign that breaks families' hearts because it often looks like carelessness or defiance before anyone recognizes what it really is. Sign number 1 is poor judgment and a reduced ability to see danger. This is where the person starts making decisions that feel strangely unsafe, impulsive, or out of character. They leave the stove on. They open the door to strangers. They hand out private information on the phone. They insist they can manage situations that are clearly beyond them. And because they may still speak confidently, the family underestimates how impaired judgment has become. Let me tell you about Darlene from Wichita, Kansas. Darlene had always been cautious with money and deeply skeptical of scams. Then, one afternoon, her son discovered she had nearly given her banking information to a caller claiming to be from Medicare. When he confronted her, she was offended. She truly believed she had handled it appropriately. A few weeks later, she left a burner on under an empty pan and walked into the backyard. These were not random mistakes. They were warnings that the part of her thinking responsible for judgment, risk awareness, and sequencing was no longer protecting her the way it once had. This is why vascular dementia is so often mistaken for bad choices or just getting careless. Families argue, they scold, they reason, but the issue is not always attitude. Sometimes the brain's ability to evaluate danger has been weakened, and that is why number 1 is so serious. When judgment starts to go, safety goes with it. Money, driving, medications, appliances, and falls all become bigger risks. By the time poor judgment becomes obvious, the family usually realizes the earlier signs were already there. The mood change, the slowed thinking, the gait change, the trouble with steps, it was all connected. Now let me pull this together because this part changes how you look at the entire condition. Vascular dementia does not always walk in through the front door wearing a name tag that says memory loss. Sometimes it comes in through the side door. It looks like apathy. It looks like irritability. It looks like walking slower, paying a bill incorrectly, getting confused with directions, or pausing too long before answering a simple question. If you only watch for classic forgetfulness, you may miss the real beginning. And that is exactly why so many families are caught off guard. There are also people who need to be especially alert to these signs. If you are over 60 and have high blood pressure, diabetes, high cholesterol, sleep apnea, a smoking history, atrial fibrillation, heart disease, prior stroke, or mini strokes, your risk is higher. If you've ever been told you have vascular disease, plaque in the arteries, or white matter changes on a brain scan, you should take these signs even more seriously. Vascular dementia does not arise out of nowhere. It often grows in the same soil that grows heart disease and stroke. So what should you do if some of these signs sound familiar? First, do not panic. One sign by itself does not automatically equal dementia. Depression, medication effects, infection, vitamin problems, sleep disorders, hearing loss, and other conditions can also affect thinking. But do not minimize it either. Start paying attention to patterns. Write down what you're seeing. When did it start? Is it getting worse? Did it follow a stroke, a hospital stay, or a sudden health event? Examples help far more than vague statements like, "He's just not himself." When families come to a doctor prepared, the visit becomes far more useful. Bring specific examples. She got lost driving home from church. He can't follow the steps to pay bills anymore. Her walking changed over the last 6 months. He seems slower to think and more apathetic. Those details matter. A doctor may ask about daily functioning, mood, medications, vascular risk factors, and past strokes. There may be memory and thinking tests, blood work, and brain imaging. Diagnosis can take time, but the earlier the pattern is recognized, the better the chance of protecting what function remains. And here's the part I need every viewer over 60 to hear. If you notice possible early signs, the goal is not just to label the problem, the goal is to reduce future damage. Managing blood pressure, diabetes, cholesterol, smoking, sleep apnea, inactivity, and heart rhythm problems can matter tremendously. A healthier vascular system supports a healthier brain. Even when damage cannot be reversed, slowing further injury is meaningful. It can preserve independence, improve safety, and buy valuable time. That is why early recognition matters so much, not for fear, for action. Let me give you a simple rule. If the change is sudden, especially with weakness, speech trouble, facial droop, severe confusion, or abrupt imbalance, call 911. If the change is gradual but persistent, call the primary care doctor or a neurologist and schedule an evaluation. If the person insists nothing is wrong, don't get trapped in an argument. Focus on facts. Point to examples. Explain that changes in thinking, mood, walking, and judgment deserve a medical look, just like chest pain or shortness of breath would. Brain symptoms are health symptoms. Treat them that way. And I want to end with George, the man I told you about in the beginning. Once his family stopped calling it just slowing down and started describing the actual pattern, everything changed. He was evaluated. His vascular risk factors were addressed more aggressively. The family made the home safer. They simplified finances, organized medications, and adjusted expectations with compassion instead of frustration. They couldn't erase what had already happened, but they could stop making the mistake of pretending nothing was happening. And that shift gave George more support, more dignity, and a better path forward. So here are the 8 early signs again. Mood or personality changes, trouble doing familiar tasks, getting lost in familiar places, word finding or reading and writing. Trouble, changes in walking, balance, or bladder control. Slowed thinking and planning, the one most people miss. Stepwise decline after strokes or mini strokes, and poor judgment or reduced awareness of danger. If you recognize several of these, don't ignore them. Listen to what the pattern is telling you. The earlier you act, the more you may be able to protect. If this video helped you, subscribe to the channel, share it with someone over 60, and keep learning with me. Because the truth is, the earlier you recognize what the brain is whispering, the less likely you are to hear it only after it starts screaming. Take care of yourself, take care of the people you love, and I'll see you in the next video.